Assalamu alaikum dear students. Today our topic is great vessels of the neck. In this topic we will be studying the course of these vessels through the neck and their distribution through their various branches. The great vessels of the neck include the common carotid artery on either side and its terminal branches, the external carotid artery and the internal carotid artery, and the internal jugular vein on either side in the neck. First we will start from the common carotid artery. This is the left common carotid artery and this is the right common carotid artery. The origin of these two arteries is different. The right common carotid artery arises from the brachiocephalic trunk. This is the brachiocephalic trunk which arises from the arch of the aorta in the thorax and it passes upward. When it reaches just behind the right sternoclavicular joint, it divides into two, the right subclavian artery and the right common carotid artery. So the right common carotid artery arises from the brachiocephalic trunk immediately behind the right sternoclavicular joint, and its course is then in the neck. It is present only in the neck then. On the left side, the left common carotid artery arises directly from the arch of the aorta in the superior mediastinum and it ascends upward in the thorax, and after crossing the left sternoclavicular joint, it enters the neck and the rest of its course is in the neck. Both left and right common carotid arteries ascend in the neck just lateral to the trachea and esophagus. This is trachea, and back to the trachea, posterior side of the trachea, the esophagus is present. So both left and right common carotid artery ascend in the neck just lateral to the trachea and esophagus with an epiphyseal compartment called the carotid sheath, and they are present with an epiphyseal compartment along with the internal jugular vein and the vagus nerve on the posterior side. So these left and right common carotid artery ascend in the neck along with the internal jugular vein and the vagus nerve. They ascend in the neck on either side in a facial compartment called the carotid sheath. They give no branches in the neck, and near the superior edge of the thyroid cartilage, each common carotid artery divides into two terminal branches, that is the external carotid arteries and the internal carotid artery. The superior part of each common carotid artery and its division into the external carotid artery and internal carotid arteries occur in the carotid triangle. This is the carotid triangle and this is the common carotid artery and its division into external and internal carotid arteries. At the superior edge of the thyroid cartilage, each common carotid artery divides into its terminal branches, the external carotid artery and the internal carotid arteries. At the bifurcation, the common carotid artery and the internal carotid artery are dilated, and this dilatation is called the carotid sinus. It contains the receptors which monitor changes in the blood pressure, and they are innervated by a branch of the glossopharyngeal nerve. Another collection of receptors occur in this area. Another collection of receptors occur in this area of bifurcation and is responsible for detecting changes in the oxygen content of the blood. That is the blood chemistry, particularly the oxygen content. And this is called the carotid body. And the carotid bodies are innervated by the branches of both glossopharyngeal nerve and vagus nerve. First, we will discuss the external carotid artery. The external carotid artery is one of the terminal branches of the common carotid artery, the other branch being the internal carotid artery. The external carotid artery supplies the face, scalp, tongue and maxilla. It begins at the level of upper border of the thyroid cartilage and it terminates in the substance of the parotid gland by dividing into its terminal branches the superficial temporal artery and the maxillary artery. At its origin, where its pulsation can be felt, the arteries lie within the carotid triangle. The external carotid artery has a slightly curved course. In its lower part, it is anteromedial to the internal carotid artery, and in its upper part, it is anterolateral to the internal carotid artery. The external carotid artery, this one is crossed by the posterior belly of the digastric muscle, and also it is crossed by the stylohyoid muscle. This is the styloid process and this is the stylohyoid muscle. So it is crossed by the posterior belly of the digastric muscle and the stylohyoid muscle. Now we will discuss the branches of the external carotid artery. The external carotid artery gives off 8 branches, which are the superior thyroid artery, the lingual artery, the facial artery, the occipital artery, the posterior auricular artery, the ascending pharyngeal artery, the maxillary artery, and the superficial temporal artery. Out of these 8 branches, the first 3, that is the superior thyroid artery, the lingual artery, and the facial artery, arise from the interior aspect of the external carotid arteries, while the next 2 branches, that is the occipital artery and the posterior auricular artery, arises from the posterior aspect of the external carotid artery, and 1 branch, that is the ascending pharyngeal artery, arises from the medial aspect of the external carotid artery. The maxillary artery and the superficial temporal artery are the 2 terminal branches of the external carotid artery. So the external carotid artery has 8 branches, and the word external also contains 8 alphabets. So the number of branches can be remembered. Now we will discuss the branches of the external carotid artery one by one. This is the superior thyroid artery, which arises from the front of the external carotid artery just below the level of the tip of the greater carno of the hyoid bone. It descends almost vertically downward and reaches the upper pole of the thyroid gland to which it supplies. One of its branch, the superior laryngeal artery, accompanies the internal laryngeal nerve, pierces the thyroid membrane and supplies the larynx. The other branch is the ascending pharyngeal artery. The ascending pharyngeal artery is a small, thin, long branch which passes on the wall of the pharynx and supplies it. The other branch is the lingual artery. This one, the lingual artery, arises from the external carotid artery opposite the tip of the greater carno of the hyoid bone. It arises from the external carotid artery opposite the tip of the greater carno of the hyoid bone. It loops
loops upward to enter the submandibular region. This loop is superficially crossed by the hypoglossal nerve. The next is the facial artery. It rises from the external carotid artery just above the level of the tip of the greater cornu of the hyoid bone. It arches upward deep to reach the posterior part of the submandibular gland. It supplies the face. Next is the occipital artery. The occipital artery arises from the external carotid artery opposite the facial artery. And then the occipital artery. The occipital artery arises opposite the facial artery. It passes upward and reaches the back of the scalp. Its terminal part is accompanied by the branches of the greater occipital nerve to supply the back of the scalp. So this was the occipital artery. Then comes the posterior auricular artery. It arises from the external carotid artery at the level of the upper border of the posterior belly of the digastric muscle. It passes upward to reach the auricle. Then comes the terminal branches of the external carotid artery. One is the superficial temporal artery, other is the maxillary artery. The superficial temporal artery is the smaller terminal branch of the external carotid artery. It ascends in front of the auricle and then divide into an anterior branches and posterior branches which supply the skin over the frontal region and the temporal regions.
This is the external carotid artery and these are its branches and these are their further branches. Let us discuss them. This is the superior thyroid artery which gives out the infrahyoid artery, the superior laryngeal artery, the cricothyroid branch, the glandular arteries and the sternomastoid branch. This is the lingual artery which loops upward and it gives off the following branches: the suprahyoid artery, the dorsal lingual branches, the inferior, this is the sublingual artery, and then is the facial artery which has loops in its course. It gives off ascending palatine branch, the tonsillar branch, the submental artery, the inferior labial artery, the superior labial artery, the lateral nasal artery and the angular artery. Opposite the facial artery is the occipital artery which gives the sternomastoid branches, a descending branch to the muscles, and the mastoid branches enter the mastoid foramina and enter the posterior cranial fossa. Then is the posterior auricular artery which gives of the stylomastoid branch and an occipital branch, followed by the terminal branches, the maxillary artery, whose branches we will discuss later on, and the superficial temporal artery. Its branches are the transverse facial artery, the zygomatico-orbital artery, and this one is the anterior auricular branch, and the deep temporal artery and anterior branch and posterior branch, finally divided into anterior branch and posterior branch. Now we will discuss the branches of the maxillary artery. The maxillary artery is one of the larger terminal branch of the external carotid artery. Its course is divided into three parts according to the structure related. The first part is the mandibular part because it is related to the mandible. The second part is the pterygoid part because it is between the two heads of the lateral pterygoid muscle, and the third part is pterygopalatine part because it is present in the pterygopalatine fossa. So each part gives different branches. The first part gives 5 branches, the second gives 5 branches, and the third part gives 6 branches. The first part gives the deep auricular artery, the anterior tympanic artery, middle meningeal artery, excessive meningeal artery, and the inferior alveolar artery. Then the second part comes. The second part gives the deep temporal artery and the lateral pterygoid artery and the medial thyroid artery. After that, it gives the mesenteric artery and the buccal artery. Then comes the third part. From the third part, the artery of the thyroid canal, this one, and then the Pharyngeal artery, and this one the descending palatine artery or greater palatine artery, and then the posterior superior alveolar artery, the posterior superior alveolar artery, and then the spinopalatine artery, and finally is the infraorbital artery. So these are the branches of the three parts of the maxillary artery.
The structure passing between the external and internal carotid artery are the deep part of the carotid gland, the styloid process and the styloglossus muscle, the stylopharyngeus muscle, the glossopharyngeal nerve, and the pharyngeal branch of the vagus nerve. The internal jugular vein is the largest vein in the neck. It begins as a direct continuation of the sigmoid sinus at the base of the skull below the jugular foramen. It descends vertically downward to end behind the sternal end of the clavicle by joining the subclavian vein to form the brachiocephalic vein. The internal jugular vein drains the brain and most of the tissues of the head and neck. The right internal jugular vein is usually larger than the left internal jugular vein because it drains the larger superior sagittal sinus, and the left internal jugular vein drains the smaller inferior sagittal sinus. The internal jugular vein presents two dilatations, one at the start, which is known as the superior bulb, and which lies in the jugular fossa and is related to the floor of the middle ear. The second lies near the termination of the internal jugular vein, and it lies in the lesser supraclavicular fossa between the sternal and clavicular head of the sternocleidomastoid muscle. It is known as inferior bulb, and it is guarded by a pair of valves. This internal jugular vein is vertically related to the lateral side of the internal and common carotid arteries enclosed with them and the vagus nerve in a common facial sheath called the carotid sheath. The deep cervical lymph nodes lie along its entire course. The tributaries of the internal jugular vein are the inferior petrosal sinuses, the pharyngeal veins, the common facial veins, the lingual veins, the superior thyroid vein, and the middle thyroid veins. These are the tributaries of the external jugular vein, and this is communication between the external and the internal jugular vein.